Hey guys, Dr. Justin Marchegiani here. We're going to be chatting about low FODMAP diets. Can they help heal your gut? We'll kind of look at the underlying physiology. Before we do, please smash the like button. Love to see your comments down below as well. All right, so let's dive in here out of the gates. Can a low FODMAP diet help heal your gut? So first thing out of the gate is decreasing gut dysbiotic bacteria. So we have bad bugs in our gut. These bad bacteria can be there for lots of reasons. It could be from poor diet, processed foods, junky digestion, enzymes, acids, bile salts, exposure to antibiotics, lots of stress when eating, that sympathetic nervous system tone. All of the above reasons why you need to be addressed, but that could be part of the reason why this overgrowth is there. Now, this bad bacteria increases endotoxins, which are lipopolysaccharides, LPS. These are stressors on your gut, and they can increase gut permeability. They can make their way into the bloodstream, increase brain fog, increase fatigue, increase mood or mental issues. And so when you look at gut issues, if we can lower dysbiosis, we lower endotoxin or LPS. That decreases stress in the liver, decreases gut permeability, helps with brain, energy, mood, etc. So when we help the gut, it spirals into lots of different things. So out of the gate, what's a low FODMAP diet? That's a low fermentable diet. Fructose, oligo, disaccharide, mono, and polyol. These are fermentable sugars. They're in healthy foods too. So it's kind of frustrating. You're like, hey, I got these issues. Should I go on a low FODMAP diet? Now, FODMAP diet isn't the whole thing. We'll talk about why. There's a lot of junky foods on it that are considered low FODMAP. So you want to look at everything. Is it nutrient dense? Is it anti-inflammatory? Is it low toxin? We want to look at it holistically, and then we can say, hey, should we also work on getting the fermentables down? Now, fermentables will definitely have an impact on your gut bacteria, commensal bacteria, which is your normal flora. It can definitely lower it, but more importantly, it can, which may not be the best thing. I'm not too worried about that because you can always bring that up after the fact. I'm more worried about decreasing the dysbiotic bad bacteria, because that decreases the endotoxins, that decreases the leaky gut. So it's good to look at that. So we want to decrease the dysbiotic bacteria. That's going to decrease the endotoxins. Endotoxins increase gut permeability, number 2. So zonulin is one of these proteins that goes up when the gut lining is being unzipped. And so blood zonulin is the better marker over stool. But I'm not a huge fan of like leaky gut markers because they don't tell you what to do. They don't tell you why the gut's leaky. They don't focus on the corrective actions to reduce it and make it better. So it's just kind of like a fire alarm. It just tells you there's something there, but doesn't tell you where, how, when did it get there per se. It just tells you that it's happening or it's at a higher level. And so I'd rather look deep upstream. What's the underlying cause? What should we do about it? That's a downstream effect. But, zonulin's that marker there. There is stool zonulin and blood. Blood's going to be the better marker. Now, when you have lots of dysbiotic bacteria in the gut, that can increase histamine. That can make you brain foggy. That can make you probiotic intolerant, sensitive to probiotics, right? Histamine issues. You're sensitive to fermented foods, sauerkraut, kimchi, right? You have some bacon, you have some cheese. Maybe you're really sensitive to it. You get foggy. You get flushed, right? That flushing symptom. A lot of your histamine, when you have dysbiotic bacteria, comes from your bad bugs in your gut. So if we can knock the gut bacteria down, that makes a huge difference in helping you heal. And so whether it's Citrobacter, Klebsiella, Proteus, Morganella, right? These are all bad bacteria in the gut. And then if we can lower that load, that's going to decrease the LPS. That's going to help the motility, because these dysbiotic bacteria, they produce gases like methane and hydrogen. Methane impacts constipation, slower motility, hydrogen on the diarrhea, the faster motility. So if we can essentially start starving out some of the bugs, that can make a big difference on the motility and just how your digestive system functions. So good to look at that. And again, we can impact histamine because that's going to decrease as we get the gut bacteria down. Also, healthy gut bacteria produces DAO, diamine oxidase, which also does help lower histamine as well. Now, 80% of your immune cells are in the gall and the malt, the mucosal associated lymphoid tissue and the gastric associated lymphoid tissue. This is important because if we have lots of inflammation in our gut, it's going to overactivate our immune system. That's going to put stress on our body. When we're over-secreting cytokines and interleukins, we have a greater chance of food allergens, greater chance of gut permeability. We have this molecular mimicry thing that can happen with food proteins getting into the bloodstream, and then our immune system tags it and makes antibodies for other surface proteins that look similar to it. So a la gluten and Hashimoto's, or dairy and casein and type 1 diabetes. So you really want to decrease that inflammation, calm down the immune system. Our body is pretty hardwired to want to deal with immune stress and allocate energy and mood resources to it. So when you get sick, you get tired, you get moody. Why? Because not because of the virus or the infection, but because your body's kind of hardwired to allocate other resources, which could be more on the performance side, and put them towards the fighting that infection. So that's important. Now, when you work on lowering bacterial load from a low FODMAP diet, that can decrease some of the bugs, decrease some of this dysbiotic bacteria. Now, if we look over here, well, what's a low FODMAP diet from a food perspective? Now, this is interesting here out of the gate. So when you take a look, you're going to see here, this is your Cleveland Clinic website that shows what a low FODMAP diet is, right? This is Cleveland Clinic. This is like kind of your mainstream conventional medicine type of place. Now, you're going to see, okay, vegetables, right? That's, that's good, right? This is low. So we want to decrease these things. So these are foods that are on a high FODMAP diet. So these are things we want to decrease. So high FODMAP's vegetables, so certain veggies. This is why I said, okay, maybe FODMAP diet, high FODMAP isn't the best because you're cutting certain healthy vegetables. That's true, but if it helps with your symptoms, that can be helpful. Certain fruits, dairy, even some protein sources, typically more in the processed meats, legumes, some breads and cereals, some sugar, sweeteners, and nuts, right? Okay, fine. But then what can I have? What are the alternatives? Now, the problem is you're going to see dairy. Well, that could be a food allergen. You're going to see tofu or other types of tofu is a questionable food. Some breads and cereals, cornflakes, oats, rice, sourdough, spelt bread, still wheat, right? And barley, free breads, and then sugars and sweeteners, and then nuts and seeds. So you can have a lot of nut allergies, dairy allergies. You could have a lot of grain allergies, and that could be problematic, right? This could definitely be an issue, and you may still not heal thinking, hey, I'm doing a low FODMAP diet. Dr. J said I should heal. Well, there's still a lot of other inflammatory foods in there, and a lot of foods that are potentially processed, especially with the grains, that may not be your best approach. Now, if you look at my paleo FODMAP template here, this is where we're looking at foods that are more nutrient dense, anti-inflammatory, low toxin. So we look at, your low, medium, and high, and you can see here some of the low ones. I put AI next to them so you can see which ones are going to be more autoimmune friendly. And so you can see AI means avoid if on autoimmune. So you can see here we have more anti-inflammatory, nutrient-dense vegetables. We have some fruits, whether it's some berries or green apples, those kind of foods there, bananas, green-wise, right? Green, if you have it spotted, starts to get yellow, that starts to ferment. And then you can see some of your starches that are going to be grain-free. In case you have weight issues, you need to keep the carbs up, you can use some of these safe starches in there. And then you can see butter. Again, none of these are AI approved. None of these are autoimmune approved. And your meats, you're pretty much good with the exception of eggs or hemp if you're AI, autoimmune. And then you can see some of the fats and oils that you can do, whether it's coconut, avocado, olive oil, different oils there. So it's helpful to look at it. So you can see here, you may fall short on a low FODMAP diet from your conventional gastro because they're recommending lots of foods that have food allergenicity and hyperallergenic to it. And again, the foods that are high still can have a lot of healthy foods. So the goal is we don't want to be on these type of foods forever, right? The goal is we want to really cut these foods out for a period of time, knock down that microbiome, and then start to transition and add some of these kind of paleo foods back in, whether it's nuts or seeds or eggs or ghee or butter or some of these healthier foods. So it's good to look at it holistically, knock down some of the microbes. It's good to get testing in the meantime because you could have other bugs, H. pylori parasites, you could have fungal issues, and some of these may not necessarily impact it. And a lot of the higher carb stuff could still feed a lot of yeast. That's why you got to look at it holistically. It's not just, SIBO or different dysbiotic bacteria. It could be other things going on. And a low FODMAP diet may not be the be all or end all. So you got to look at it holistically so you can see if this is right for you. That gives you a pretty good idea of kind of what to look at. And again, adding probiotics in and fermentable foods on the backside can be helpful. It's good to add some of these foods back in because that will help bring up some of that commensal bacteria we may have knocked down. So it's nice to bring those back up. That can move the needle a lot. And so it's good to have some testing out of the gate so you can look at it holistically to make sure there's not other things there. And you got to get your enzymes and your acids up because if you're eating a lot of fermentable foods or foods in general, but you're not breaking them down all the way, protein, fats, and carbs, they could ferment, rancidify, putrefy inside of you. So you really got to get your enzymes and your acids dialed in as well. All right, guys, Dr. J here. If you want to dive in deeper on the functional medicine side from a patient perspective, there'll be links down below, coordinates where you can reach out to my team and schedule worldwide. All right, guys, enjoy today's video. Put your comments down below. Love to see it. Have a good one, you all. Take care. Bye.